Hello, this is my video for hypothyroid. Hypothyroid is an underactive thyroid. The thyroid is a gland in your endocrine system, which is just in your throat here. And it produces hormones which regulate your body's metabolism. So if you have an underactive thyroid, you're going to have a sluggish metabolism. And so overall, that's going to lead to things like fatigue, depression, weight gain, cold intolerance, irregular menstruation, dry skin, brittle hair or nails, and voice changes. So if a patient were to come in and describe those type of symptoms, you might be pointing towards hypothyroid. Um, some of the questions you might ask to clarify that, you could ask if they are on the birth control pill, if they're taking any corticosteroids, have they been under a period of prolonged stress, and you can ask about their diet, particularly the kind of table salt they use, because there's iodized table salt, but a lot of people don't use that these days. And we are in something called the goiter belt, meaning that there's not a lot of iodine in our diet naturally, and iodine is an essential nutrient for the proper functioning of our thyroids. So if they do not use a particular kind of salt, you might look at a deficiency in iodine, and you can check for that by doing an iodine patch by putting a little bit of iodine on a soft part of the skin. You can use the belly or the inside of the upper arm here. And if it goes away in a short period of time, and a short period would be like less than 2 hours, then it'll be absorbed. Then you can suspect a iodine deficiency. However, if it's still there around the 4-hour mark or plus, you're probably not dealing with an iodine deficiency. But if you are, along with those symptoms, you can start to suspect more so hypothyroid. And you could move into two other diagnostic tools, which is a basal body temperature reading. So you have your client take their basal body temperature every morning as soon as they wake up for at least 5 days. For women, this shouldn't be started till the day after their period is over. And you take the average of those temperatures, and if it's less than 36.6, you can start being more confident that you're dealing with a hypothyroid. And that's because, again, as the metabolism slows down, that's sort of where your inner body heat comes from, so that's going to slow you down as well. That's going to push down the temperature. The other, if they're working with a doctor as well, having a blood test is probably the best way to determine an underactive thyroid. And what you'd be looking for in a blood panel would be elevated thyroid stimulating hormone. So it's actually made by your thyroid, but when that elevates in order to encourage your thyroid to produce more of the hormones T3 and T4 if it's not doing so naturally. And the other two things are T3 and T4, which you'd be looking for in the serum. If the cause of the underactive thyroid is an injury or a surgery, or it could also end up being Hashimoto's thyroiditis, which is an autoimmune condition, then it's likely going to be a permanent underactive thyroid, and likely the client will end up having to take a hormone replacement therapy. So they'll be getting thyroxine, which is T4, and they'll have to take that every day in order to replace the hormone. However, if it's due to an iodine deficiency or prolonged stress or a medication or the birth control pill, or it's just a very low level deficiency, almost subclinical, then we can use botanicals to support the HRT, but we can also use botanicals to get things back on track if it's one of those reversible causes. And for botanicals, I've chosen, firstly, especially with an iodine deficiency, we have Fucus vesiculosa, which is bladder wrack, and it's specifically anti-hypothyroid. So it supports the thyroid and as well provides a source of iodine. So that's easy. That's an infusion. You drink 3 times a day. Just make sure that your source of the fucus is as clean as possible, because there can also often be heavy metals contained in that sort of sea vegetable. And it can also be irradiated. So if you leave it at least 10 weeks before using, then that radiation will have dissipated and you don't have to worry about that. Secondly, I've chosen Capsicum annuum, which is cayenne, and it stimulates the blood flow to the periphery, which will take care of some of those, some of that cold intolerance. And the increased blood flow will also help the delivery of the either other medications or other botanicals that you're using. Thirdly, we're going to go with Crataegus levigata, which is hawthorn, and it's a cardiotonic which enhances the activity and nutrition of the heart muscles. And this is also important because atherosclerosis can be heightened in people suffering from hypotension, especially over a prolonged period. And the cardioprotective properties of hawthorn are very much appreciated in that. Thirdly, we have Eleutherococcus senticosus, Siberian ginseng, and it's an energizing adaptogen. I want the adaptogen adaptogen for basically everything, because stress is always bad. So we're going to regulate stress, but we're also going to use this one because it's energizing and we're dealing with a sluggish system. So anything to sort of pick that up would be great. And some studies in rats have shown promise to increase oxygen uptake to the liver, and it's also anti-hepatotoxic. And thirdly, it increases resistance to oxygen deprivation in the heart. So that kind of works synergistically with the Crataegus there a little bit. And the reason the liver thing is important is because T4 is metabolized into T3 within the liver. So anything that can support our liver in this process is probably pretty good. Next, we have Glycyrrhiza glabra, licorice root. And again, licorice is an anti-hepatotoxic. It's a nutritive for the endocrine system and a mild laxative. I thought a mild laxative would be helpful here because when everything's sluggish, you don't want an uneliminated feces sitting around in your gut longer than it should be there. Check for drug interactions, especially with licorice root, and if they're on any sort of cardiac medications or anything, you want to be careful around that. And lastly, we have Taraxacum officinale, and just the leaf. So we're doing dandelion leaf, and that's just a leaf you're going to chew before, about 10 minutes before meals, in order to get the digestive juices flowing and stimulate your digestion, because as a big part of your metabolism, it's not being stimulated the way it needs to through your thyroid. My recommendation there is to take the Eleutherococcus and the Crataegus in tincture form. You can make a decoction with the licorice root, and the decoction itself can actually be used to infuse the fucus, so you don't have to be drinking 1 million cups of tea every day. And the capsicum, you infuse 1 cup hot water with 1 teaspoon of cayenne, and then drink 1 tablespoon of that infusion mixed with warm water to taste whenever you're feeling cold or you want a little bit of a circulatory stimulant. And lastly, my suggestion is to sort of pulse the Eleuthero and the glycyrrhiza, 6 weeks on, 2 weeks off, just because it can be very stimulating, and giving yourself a break from the glycyrrhizin is recommended.